Good morning, friends. Today we are back on this cold winter day of 23rd, and during that, with the cold days, you may be feeling too much heavy in your life due to the cough and colds, during the fever and enduring. So there is a sensation when we used to feel during our some acute problem. But there are some also other situations where we feel very sad or very depressed or very as if there are a lot of weight on our life, heaviness. So this rubric is related to heaviness, feel sensation of. This is one of the important rubrics that appears in our repertory right from the beginning, and in the physical chapter you will find this rubrics to be very prominent: head feeling, eye feeling, abdomen feeling heavy. But in the mental chapter it is also there. So it is the mental heaviness that we used to experience due to some mental trauma or due to some situations. So let's understand this rubrics with this origin of the words and linguistic root. The term heaviness comes from the Old English word hay-fig. Hay-fig means weighty and oppressive, burdensome and sorrowful. In Indo-European linguistic development, heaviness symbolized three parallel phenomena: physical weight, emotional burden, and moral pressure or the guilt. The psychological and connotation evolved through the Middle English as a grave of mind, weight with sorrow and dullness in spirit, and later through the Latin influence via gravitas, gravity, implies seriousness or oppressed mental state. In Indian philosophical language tradition, heaviness is expressed through Sanskrit word gaurav, heaviness, gravity, maintain gravity, used to suggest maintain gravity and seriousness. And in Ayurveda psychology, mansik gaurav, heaviness of mind, tamasic, predominance, dullness and inertia. In Pali text refers to the mental heaviness, that is thena middaha, meaning sluggishness and mental torpor. So though two opposite views you can think about this rubrics: feeling of greatness or feeling of gaurav, and another is meaningless, sluggish and dullness is there. So idea of heaviness of the mind is therefore ancient, cross-cultural and deeply psychological, symbolizing an inner burden, a half in mental mobility or pressure through intellectual emotional functions. This rubrics belongs to those rubrics that look deceptively simple but unfolds profound clinical, emotional and constitutional meaning, and it represents patient's subjective experience of the mind, weighted down, slow, burdened, oppressed, and then unable to move or think or rise, and overloaded with the emotions and cognitive weight. That this is not a simple fatigue, it is a sensation of, along with the fatigueness, there is a sensation of pressure, density and mental gravity often described by the patient. Then the patient may say, my mind feels heavy, there is a weight on my head and thoughts, I feel mentally dragged down, it feels like something is sitting on my mind. This rubric reflects the stagnation of mental energy, obstruction of mental flow and emotional overload, loss of clarity and reduced cognitive brightness. It manifests in conditions such as depressions, anxiety with exhaustions, grief disorders, obsessive ruminations, and early dementia or cognitive decline and psychosomatic state, sleep-deprived psychiatric trauma pattern, and post-viral mental sluggishness, and hypothyroid mental dullness, and drug-induced mental slowness. Many situations are there after taking lot of the allopathic medicines, one feel heavy, and this is the drug-induced heaviness. In thyroid and hypertension also, one have got lot of the heaviness sensation. Now, looking into the international historical perspective, the early psychiatrists of the 18th and 19th century described heaviness of mind as melancholic gravity, mental operations, and stagnations of spirit and psychic weight. In early homeopathic literature, Dr. Henneman, Bonnigsens, Kent, Clark, and Allen recorded multiple medicines exhibiting this feature, especially in a state where mental activity slows down and consciousness feels compressed. Henneman's chronic disease mentions heaviness of mind in remedies like calcarea carp, natrum muriaticum, aurum, where it is described as weight with the sorrow, and oppression of thoughts or heavy like a cloud. So Kent interpreted mental heaviness as a symptom of depression, torpid intellect, melancholic state, torpor, and great grief suppressions and low vitality. Bogar correlated with the general state of sluggishness, a symptoms of congestive cerebral state, especially after shock, fright, and grief or blood flow disturbance. In the Indian historical perspective, it is always recognized as mental heaviness through the word tamas. That is the indications of mental dullness, inertia, confusion, and lack of mental clarity. Then in Ayurvedic psychology, it is a manobibhrama, that is confusion of mind, manodrabalya, weak mind, and mansik gaurav, mental heaviness. The influence of Ayurveda and Indian homeopathic practice is significantly making practitioners sensitive to identify gaurav, that is heaviness. Gaurav, in the sense we feel like that it is something great, but in medically this rubric is not related to that type of the gaurav. Here it is related to the that is which is there coming out from the emotional depressions, overload and suppression. Then psychological features are there. This rubric symbolizes different mental states like mental slowing, it is slowing down, emotional overload, grief, guilt, worry or stress created a sensation of burden leading to heaviness and cognitive resistance. And then also reduced motivation. The people who have no motivation, they reflect pulling down and effect leading to the inactivity or procrastination. Or internalized pressure, feeling of mental weight, often stem from pressure and social, moral or emotional. Then psychosomatic links are there. Now with this mental feeling, one starts having a feeling on the forehead or occipital head congestions in the word chest. Usually heaviness of the chest is taken, and the rubric used is the oppression of the chest. That is heaviness. And head congestion and tiredness of the eyes and lethargy. Then anxiety with the heavy thoughts are also there. Some patients oscillate between anxious restlessness and inner heaviness as an dragging down. And depressive thinking, this rubric appears strongly in endogenous or relative depressions, especially when patient expresses everything feels too much. I am mentally tired before even starting. Now the clinical features and conditions are depressive disorders, especially in dysthymia, melancholic depressions and grief reactions, anxiety disorders when mental heaviness alternate with the panic fear, hypothyroidism. It is a classical metabolic cause of mental heaviness and sluggishness. Then post-viral symptoms after the COVID-19, influenza, dengue, viral fever often produce brain fog and mental heaviness. Then chronic fatigue syndromes are also there. Mental heaviness is a cardinal feature in the chronic fatigue syndromes. Then hormonal disturbance, PMS, and menopausal cognitive dullness. And drug-induced states are there also. After taking so many allopathic medicines, you feel like as if your body is heavy, and psychosomatic state where some mental and some worries and tensions. At that time also, mind has got the heaviness. Now the patient expressions and verbal clues are like that. The exact words you can correlate with my mind feels heavy. I cannot think freely. Something pressure on my mind. Thoughts are like a weight. Everything feels like a burden. I can't lift my mind up. My mind is dark, heavy, clouded. I feel mentally suffocated. My head is not heavy, but mind is heavy. And my thoughts are stuck. I wake up with heaviness of the mind. So the expressions are essential to differentiate the rubrics related to the confusion, dullness, slowness, and despair, sadness. So heaviness is basically related to the sensation, not merely the emotional quality. And the important remedies are natrum muriticum. They are burdened by the grief, carry emotional weight, and cannot throw off the past memories and morning heaviness of the mind. Aurum metallicum feels heavy mind due to the responsibility, guilt, and failures, operations from moral burden, and serious grave mentality weight. And then calcarea carb, mental heaviness with physical heaviness, feels overwhelmed and bogged down, and difficulty in starting the task. Gelsemium also mental heaviness is there during the anticipatory anxiety. So in every medicine you can see like this, associated with some region or some situation, some circumstances. Then phosphoric acid, mental weakness and heaviness after grief, loss, and overwork, and indifferences with the cognitive heaviness. Then caliphos, mental heaviness from examination, exhaustion, worry, intellectual strain. And pulsatilla, they have got the emotional heaviness with weeping, dependency, and hormonal changes. Sipiac, chronic emotional burden leading to the dull, heavy mind. And nux moscata, heavy, sleepy, clouded mental state. And opium, heavy mind with a stuporous or subconscious stress. Now you can have some cross-reference with some of the medicines. It is linked with the comprehension slow, where mind feels slowly, they cannot understand properly, confusion, stupefaction, stupor, indolence, then sadness, grief, Elements, grief elements, then responsibility overwhelmed with and mind operations. See, the rubrics seems to be same, but operation have got slightly difference, and it is so operation and heaviness are also there. So we shall be learning about the operation later on also. Then head heaviness, differential diagnosis is needed, and head confusion, vertigo, heaviness proceedings. Cross references are brooding, dwelling on the past disagreeable occurrences, discouraged and hopelessness, and intellectual cross references are there, memory weak, study impossible, and forgetful, sluggish mind. Cross reference also you can make with heaviness due to the depressed vitality like calcarea and gelsemium, heaviness from grief, natramur and phosphoric acid, heaviness from moral pressure, aurum, and heaviness from hormonal imbalance. Now, miasmatic analysis you can do. In the soric heaviness, you have got the functional emotions, emotional weight of the worries, simple mental fatigue, and relieved by rest and consolation. Syphilitic heaviness is deep, dark, hopeless heaviness, and tendency to despair with suicidal thinking are often associated. In the psychosoric heaviness, burden from responsibility, overwork, and slow but persistent heaviness and inertia plus efforts to move. Then psychotic heaviness are fear-bound heaviness, suspicious, guilt or suppressed emotions, and mind feels blocked. So tubercular heaviness are like that. Alternating state you can find more valuable in the tubercular patients. Alternating with excitability, heaviness appear in exhaustion phase and often infectious. So miasmatic understanding is important for the long-term chronic management. Now you can differentiate some closed rubrics like heaviness plus confusion. Heaviness is pressure, weight and sluggishness. Confusion is disorganization of thoughts. Heaviness plus sadness. Sadness is emotional tone, and heaviness is cognitive sensation. And heaviness and dullness. Dullness is lack of clarity of the sharpness, and heaviness is burdened sensation. And heaviness plus stupefaction. Stupefactions, it is nearly like an unconscious state, a statue type. You say na a statue. So people stop like that. So it is like that. But heaviness is conscious but weighted. Then identifying during the case taking, you have to be very careful to identify these rubrics. Spontaneous expressions, observe the patient, how the patient use the word heavy, dense, burdened, weighty, dragging, these words he may use. Then pace of conversation, how long it takes to reply. Then patient speaks slowly with pause, different difficulty expressing thoughts. Then facial expressions, drooping eye, blank or chill, dull eye, and face appear burdened. And body language, slumped postures, slow movement, and shoulders bend forward. Emotional indicators, past grief, present responsibility, overwork or exhaustion, and unresolved internal conflict. Then you have to ask some questions also. You may ask, queries you can make. Do you feel mentally overloaded? Does your mind feel heavy or slow? Or is it difficult to lift your thoughts? So, mental examinations, you have to check with the attention span, how long they can continue attention, speed of thoughts, then responsive, mental fatigue, etc. So, heaviness of the mind is usually evident in the first half minutes of the behavioral observations. So you can, in the earliest form way, case taking, you can observe this. And deep understanding of this, it is a break in the mental flow, the current of thoughts slow down, become stuck or feel weighted. It is a symbol of inner burden, where mental heaviness symbolizes emotional loads often unexpressed. Then a failure of vital force at mental level, where vitalities that should maintain clarity and activity becomes depressed. Then a sign of suppression, it is suppressing grief, anger, emotions lead to the sensations. So then mind slow down to protect itself from excessive stimulations and precursor to depression. So before the depressions, you can have this type of the heaviness feeling. Then somatopsychic bridge, it is a bridge between the somatopsychic. So we have compared the medicines with the different rubrics. Operations is emotional suppression and heaviness is cognitive pressures. So now you can see a patient like past after the grief, mental heaviness. So my mind feels heavy all the time, weeps privately and avoid talking. Morning heaviness worse. You can think about the netramureticum, responsibility induced heaviness. A businessman overwhelmed with the work, burdened, responsible, serious, feels his mind weighted with the duty, or a metallicum. And then post-viral heaviness, a student after fever, mental, dull, heavy, cannot study, want to lie down, gelsemium. So like this, you have the exhaustion also. A mother care for a sick child, so she become mentally exhausted, heaviness after the long caregiving. So you can think about the phosphoric acid. Then, so this word, Rubric's heaviness sensation of is extremely valuable indicator of inner burden, mental stagnations, emotional overload, or weakened vitality. It represents a sensation not openly an emotional tone. And by understanding this rubrics, careful listening, you have to careful listening of the patient expression, observing his mental pace and body language, and differentiating from confusion, dullness and sadness, and integrating miasmatic background and identifying causative factors like grief, overwork, hormonal changes, viral illness, etc., and then choosing the remedy that covers the constitutional state. So mental heaviness indicates a compression of the inner self, a slowing of the mental current, and an impaired mental clarity. It can reflect the beginning of deeper psychological dysfunction, making it essential for early detections and treatment. So if you have to, for recognizing these powerful rubrics, you have to correlate with the complete symptomatology and prescribe the similimum to relieve the inner weight of the of the patient, so that it can be restored lightness and clarity, and the mental freedom can develop. So friend, this state is very much important, and we have to be careful when you take care of this this type of the rubrics. And but it is not only that it is you can go by the, you have to observe it gives you the entire state of the life of the patient. So it is very deep overall rubrics, overall presentations of the patient is there. So we have to be careful with this. So thank you. I feel that it is now complete now, and we shall meet again tomorrow with another rubrics. And meanwhile, if you want to listen in Hindi also, it will be uploaded tomorrow on the YouTube channel. You can go through that also. You can have, so that you can have a better understanding. And now I have started uploading the rubrics in both Hindi and English, so that every people can get benefited. So with these words, I thank you very much, and we shall be back again with another rubrics. Thank you very much.